Hello, this is Dr. Ruby, and welcome to the lecture for Module 13. In this module, we will discuss human posture. The objectives of this module are to define the components of normal posture, to identify common faulty postures, and then to identify the muscle imbalances that can cause these faulty postures.
Good posture is defined as the state of muscular and skeletal balance that protects the supporting structures of the body against injury or progressive deformity, irrespective of the attitude or the body position. Muscles function most efficiently in good posture. When the body is in good posture, the joints will perform along the path of instantaneous center of rotation, and there will be less risk of wear and tear. This posture is desirable for total well-being. We can use a plumb line to describe normal posture or to identify variations from normal. When standing laterally to a plumb line, the string will pass slightly anterior to the medial malleolus, or the outside ankle bone, slightly anterior to the knee, through the greater trochanter, or the hip bone, midway between the back and the abdomen, midway between the front and the back of the chest, and through the earlobe. Poor posture is defined as a faulty relationship of parts of the body, which produces increased strain on the supporting structures and in which there is a less efficient balance of the body over its base of support. Poor posture can develop over time from muscle imbalance due to weakness, inflexibility, or injury. Oftentimes, the posture is developed from activities which are repeated frequently. For example, rounded shoulders are a common characteristic of swimmers, and hyperlordosis is a common characteristic of gymnasts. In a sense, we become what we do. There are several common faulty postures. They develop from the activities that we expose ourselves to. Just being in one position for longer than 20 minutes at a time can begin to change muscle length. The muscles will adapt and then gain strength only at that new length. This can cause a significant muscle imbalance that will lead to a change in posture. The photo on the far right is of normal posture. The other three photos exemplify common faulty postures seen in the general population. On the left, the lordotic posture with an increased thoracic kyphosis. Second one from the left, the flat back posture, also with a thoracic kyphosis and a forward head. Third from the left, the sway back posture with a forward head. The first common faulty posture that we will discuss is the lordotic posture, also called the hyperlordotic posture. This is a common posture of a gymnast. The most identifying feature of this posture is an anteriorly tilted pelvis. This means that the front of the pelvis is lower than the back of the pelvis. This posture is often referred to as lower cross syndrome. The hip flexors and erector spinae form one line in the cross, and the hamstrings and the abdominals form the other line. The hip flexors and the erector spinae are both shortened. The hamstrings and the abdominals are both lengthened. This imbalance is what causes the pelvis to sit anteriorly and the lumbar spine to increase its lordosis. Therefore, we call this the lower crossed syndrome. The flat back posture. The most identifying feature in a flat back posture is a posteriorly tilted pelvis. This means that the front of the iliac crest will be higher than the back of the iliac crest. This posture is a common male posture and creates a rigid torso. They are the opposite of the lower cross syndrome, with short hamstrings and abdominals and long erector spinae and hip flexors. These people tend to power with their hamstrings and neglect their gluteals, which often atrophies in the buttocks. The swayback posture is often confused with the hyperlordotic posture because from the side there appears to be a lumbar lordosis. However, the pelvis in the swayback is not anteriorly tilted. It will be either neutral or posteriorly tilted. The hips are in full extension and the rib cage sits behind the pelvis. In this posture, the external oblique is lengthened and the rectus abdominis is short, causing a depressed chest and rib cage. This posture is often the most difficult to work with, and Pilates has exercises that can successfully change this postural type. There are also upper body postures that can become a component of any of these common postures. The kyphotic posture is one of the more frequent upper body deviations. This posture is commonly found in the older population because as we age, the rib cage becomes immobile and stiff. It is also often combined with the hyperlordotic posture. Pilates breathing can help to prevent this posture and significantly improve its effects on breathing by mobilizing the rib cage. I often tell my older clients that the breathing will keep them young. Another frequent upper body posture is the forward head, and it may appear in combination with any of the lower body postures. In this posture, the shoulders round forward, causing the person to gaze downward. They then tip their head upward, extending the upper cervical spine, creating the forward head position. This is often called upper cross syndrome because the neck flexors and the suboccipital muscles become short and the long neck extensors become long. The cue of reaching out of the top back of the head used in Pilates exercise can help to correct the muscle imbalances that create this posture.